Okay, Senator Hassan.
Thank you, Mr. Chair, and to the ranking member for this hearing, and to the Surgeon General. It's really good to see you, and thank you for being here. I have heard repeatedly, Dr. Murthy, from the parents of children who are struggling with mental health issues but can't access treatment. Even if the families have private insurance, their provider networks are inadequate, and the workforce can't meet what is now a crushing need for pediatric mental health services. Parents recount calling every provider in the region and being told that there are waits of 4 to 6 weeks for remote sessions and 3 to 4 weeks for inpatient programs. How do these long wait times affect children's mental health, and what can we do to ensure that children in need can find treatment?
Well, Senator, it's good to see you again as well, and thank you for that question. I have heard those stories time and time again myself, and over the years. And long wait times are troubling for multiple reasons. When a child is not able to see a provider in a timely way, that means more time that child is struggling, not getting the help they need, and potentially at risk of harm to themselves. But the other consequence is to their families, to the parents of children who cannot get help. I'll tell you this, as a parent myself, there is no feeling worse than knowing that you cannot get your child the help he or she needs. That is the worst feeling for a parent. And there are millions of parents who are going through that because they see their child suffering, they can't get them assistance. So that is why we have to close that gap. That is as much as about workforce as it is about using technology to provide adequate care, as it is about making sure reimbursement is adequate so that we can support a health system with enough access.
Thank you. I also want to talk about what's going on in our schools a little bit here. Schools are our first responders to the youth mental health crisis, but they often lack sufficient personnel to help students manage mental health issues. One New Hampshire counselor shared her experience explaining, quote, "My students are frustrated and feel as though they are on the back burner of care. It is assumed that now that children are back in school, the issues that they faced when at home will go away, but they're getting worse. We have minimal supports in the schools," close quote. So look, we just talked about, we need to increase the number of mental health professionals generally, but we also need to really focus on increasing the number of mental health professionals in schools. But in the meantime, we have to ensure that teachers have the support that they need to address the crisis occurring in their classrooms today. How can we give educators the training, resources, and support that they need to continue helping our children during this mental health crisis?
Such a good question. Senator, I have always felt that there are a lot of parallels between healthcare workers and teachers.
Yeah.
They're both in the business of healing, and unfortunately right now, they've both been on the front lines of COVID, and they're burning out in extraordinary numbers. I think supporting educators is going to be critical to supporting kids. And to do that, we, number one, have to make sure that the workload on educators is reasonable. What I have seen even in my children's school is that the educators have had to become public health experts overnight. They've had to make difficult decisions about everything from whether to invest in better ventilation, how frequently to do tests, to how to help kids with their masks. This is on top of everything they were doing before. So we need more support for our educators. Part of the support that we need are more counselors and mental health professionals in our schools. Rather than expecting kids to go miles and miles away to where the care is, we got to bring the care to kids. And finally, we've got to provide mental health support services for the educators themselves. They are under an extraordinary amount of stress and trauma. They need support, and we got to bring that support to them as well.
Right. And one of the things, too, though, I think, is we've got some models when we're dealing, for instance, with substance use disorder of some pilot programs that really have worked to help teachers understand what their students are perhaps going through if there's substance misuse at home or if an older student is experimenting with substances. So I think there's some parallels there, too, just to give teachers some basic tools. Let me turn to a topic that I think is a growing concern. I hear about it from my constituents, but I also hear about it from providers, that the increased use of social media by young people has accelerated the youth mental health crisis. However, as highlighted in your advisory statement, independent researchers face barriers when they are trying to access data from media companies. As a result, the relationship between digital technologies and mental health is really poorly understood. So how can we support research to better understand the impact of social media on youth mental health?
Well, Senator, you're right to point this out. We have a real problem with transparency now. Our social media companies, other technology companies have data about how these platforms are impacting our children, about which kids are at greater risk, and our kids do not, independent researchers don't have access to this data. We need that data to be shared publicly, but we also need safety standards. I think that's a very reasonable thing to consider here. We have safety standards for cars and for other consumer sort of goods. This is a tool, these platforms that millions and millions of children are using. We need to protect our kids, and that's where safety standards, I think, will be essential as well. There are researchers standing by at the ready who want to do the investigation, who want to look at the data, who want to help parents figure out how to protect their kids. They're handcuffed right now because they don't have access to that data.
Okay. Thank you. I'd look forward to working with you on moving forward on that. Thank you, Mr. Chair.
Thank